How do you prepare for a muscular dystrophy clinical examination? Getting ready for a muscular dystrophy clinical exam might seem overwhelming, but knowing what to expect can make it easier and more effective. First, gather your personal and family medical history. Think about any muscle weakness, trouble walking, or coordination issues you or your relatives have experienced. Be ready to describe when symptoms started, how they've changed over time, and if they follow a certain pattern. This helps your doctor understand your situation better. Next, wear comfortable clothing that allows easy access to your muscles. Loose clothing or shorts and a t-shirt are ideal so the doctor can examine your muscles, joints, and posture without difficulty. Before your appointment, avoid strenuous exercise for at least 24 hours. Exercise can temporarily raise muscle enzyme levels, which might affect test results, especially for creatine kinase, a common blood marker for muscle damage. Your doctor will likely order blood tests to measure creatine kinase levels. Elevated levels often indicate muscle breakdown, which is common in muscular dystrophy. You might also be asked to provide a blood sample for genetic testing, which can identify specific gene mutations linked to different types of muscular dystrophy. Be prepared to give a detailed family history, as some forms are inherited. Additional tests may be part of your evaluation. A muscle biopsy involves taking a tiny sample of muscle tissue to look for characteristic changes under a microscope. Electromyography, or EMG, uses a small needle, electrode inserted into muscles to record electrical activity, helping to distinguish muscular issues from nerve problems. Heart and lung assessments, such as electrocardiograms, echocardiograms, or pulmonary function tests, may be scheduled because some muscular dystrophies affect these organs. Bring any previous medical records, test results, and a list of current medications to your appointment. Preparing questions about your diagnosis, treatment options, and what to expect moving forward can also be helpful. Remember, every person's experience is unique, so follow your healthcare provider's advice closely and seek personalized guidance. In summary, preparing for a muscular dystrophy clinical exam involves collecting detailed medical history, wearing suitable clothing, avoiding strenuous activity beforehand, and being ready for blood tests, genetic analysis, and possibly muscle or heart tests. Bringing your medical records and questions ensures a thorough evaluation. Always consult your healthcare team for tailored advice, and keep in mind that early and accurate diagnosis helps guide the best possible care and support.